Knee osteoarthritis is a chronic and degenerative joint disease that affects millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones gradually wears down, leading to pain, stiffness, swelling, and reduced mobility. This condition is most common in older adults, but it can also develop in younger individuals. Due to factors such as joint injuries, obesity, and genetic predisposition, as the disease progresses, the joint space narrows and bone-on-bone contact can lead to the formation of bone spurs, further exacerbating symptoms. In advanced cases, osteoarthritis can significantly impact quality of life by limiting mobility and increasing dependence on pain management strategies. The primary cause of knee osteoarthritis is the gradual deterioration of articular cartilage, which is responsible for providing smooth and frictionless movement of the joint. Cartilage is a firm but flexible connective tissue that does not have a direct blood supply, making it difficult for damaged cartilage to heal. Over time, the continuous mechanical stress on the knee joint contributes to its breakdown. Factors that increase the risk of developing knee osteoarthritis include aging, excessive body weight, previous knee injuries, repetitive stress on the joint, muscle weakness, and underlying metabolic conditions such as diabetes. Genetic predisposition also plays a role, as some individuals may inherit weaker cartilage that is more prone to degeneration. The symptoms of knee osteoarthritis typically develop gradually and worsen over time. One of the earliest signs is pain that occurs during or after movement, often described as a dull ache or a sharp sensation. Depending on the severity of the condition, stiffness in the knee is common, particularly in the morning or after prolonged periods of inactivity. Swelling may occur due to inflammation within the joint, and some individuals experience a grating or cracking sensation when bending or extending the knee. In advanced stages, joint deformity and reduced range of motion can significantly impair daily activities such as walking, climbing stairs, and standing for long periods. Some individuals may also develop muscle atrophy due to reduced activity, further complicating movement and stability. Diagnosis of knee osteoarthritis involves a combination of clinical evaluation, imaging studies, and laboratory tests. Physicians typically begin with a thorough medical history and physical examination to assess pain levels, joint stability, and functional limitations. X-rays are commonly used to detect characteristic changes such as joint space narrowing, bone spurs, and subchondral sclerosis. In some cases, magnetic resonance imaging (MRI) may be performed to evaluate soft tissue structures, including cartilage and ligaments. Although blood tests are not typically used to diagnose osteoarthritis, they can help rule out other conditions such as rheumatoid arthritis or infections. Additionally, joint aspiration may be performed to analyze synovial fluid, helping to identify inflammation or infection as contributing factors. Management of knee osteoarthritis aims to relieve symptoms, improve joint function, and slow disease progression. Treatment options vary depending on the severity of the condition and the patient's overall health. Non-surgical approaches are generally the first line of treatment and include lifestyle modifications, physical therapy, medications, and intra-articular injections. Weight management is a crucial aspect of treatment, as excess body weight places additional stress on the knee joint, accelerating cartilage degradation. Regular physical activity, including low-impact exercises such as swimming, cycling, and walking, helps, Maintain joint flexibility and strengthen the surrounding muscles. Strengthening the quadriceps and hamstrings is particularly beneficial, as these muscles help stabilize and support the knee joint. Physical therapy plays a significant role in managing knee osteoarthritis by improving joint stability, flexibility, and strength. Therapists design customized exercise programs that focus on strengthening the quadriceps, hamstrings, and hip muscles, which help support the knee joint. Additionally, stretching exercises can enhance mobility and reduce stiffness. Assistive devices such as knee braces, orthotics, and walking aids may be recommended to alleviate pressure on the affected joint and improve mobility. Aquatic therapy, which involves exercising in water to reduce joint load, is another effective approach for managing symptoms. Medications are commonly used to manage pain and inflammation associated with knee osteoarthritis. Nonsteroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen and naproxen, are frequently prescribed to reduce pain and swelling. Acetaminophen may be used for mild to moderate pain relief, although it does not have anti-inflammatory properties.
In cases where oral medications are not sufficient,
Topical NSAIDs and analgesic creams can provide localized relief for individuals with severe pain that does not respond to conservative treatments. Corticosteroid injections may be administered directly into the joint to reduce inflammation and provide temporary relief. Another injectable treatment option is hyaluronic acid, which acts as a lubricant to enhance joint movement and reduce discomfort. Platelet-rich plasma (PRP) therapy and stem cell injections are emerging, treatments that aim to promote cartilage repair and reduce inflammation, though their long-term efficacy is still being studied. In situations where conservative treatments fail to provide adequate relief, surgical interventions may be considered. Arthroscopic surgery is a minimally invasive procedure that involves removing loose cartilage fragments, smoothing rough surfaces, and addressing minor meniscal tears. However, its effectiveness in advanced osteoarthritis is limited. Osteotomy is another surgical option, typically recommended for younger patients with misalignment issues. This procedure involves reshaping the bones to redistribute weight and relieve pressure on the damaged joint. In cases of severe osteoarthritis, where joint damage is extensive, total knee replacement surgery may be necessary. This procedure involves replacing the damaged joint surfaces with artificial components made of metal and plastic, significantly improving pain and function. Partial knee replacement may also be an option for patients with localized damage. Preventive measures can help reduce the risk of developing knee osteoarthritis or slow its progression. Maintaining a healthy weight is one of the most effective strategies, as obesity is a major risk factor for joint degeneration. Engaging in regular physical activity strengthens muscles that support the knee and enhances joint stability. Avoiding high-impact activities that place excessive stress on the knee, such as running on hard surfaces or jumping, can help protect the joint. Proper posture and body mechanics, including lifting techniques and workplace ergonomics, are also important in preventing excessive strain on the knees. Additionally, wearing supportive footwear and using shock-absorbing insoles can reduce joint stress during daily activities. Nutritional factors may also play a role in joint health. A diet rich in anti-inflammatory foods, such as fruits, vegetables, fatty fish, and nuts, can help reduce inflammation and support overall joint function. Omega-3 fatty acids found in fish oil have been shown to have anti-inflammatory properties that may benefit individuals with osteoarthritis. Certain supplements, such as glucosamine and chondroitin sulfate, are commonly marketed for joint health, although their effectiveness remains a topic of debate. Adequate vitamin D and calcium intake is essential for maintaining strong bones and reducing the risk of joint deterioration. Knee osteoarthritis is a progressive condition that can significantly impact an individual's quality of life. Early diagnosis and a comprehensive treatment plan can help manage symptoms and maintain joint function. While there is no cure for osteoarthritis, adopting a proactive approach that includes lifestyle modifications, physical therapy, medications, and, when necessary, surgical interventions can improve long-term outcomes. Ongoing research continues to explore new treatment modalities, including regenerative therapies such as PRP and stem cell injections, which may offer promising alternatives for future management. Understanding the underlying causes, risk factors, and available treatment options empowers individuals to take control of their joint health and enhance their overall well-being.